Burnout is a serious issue for perioperative nurses due to a combination of factors that create a demanding and stressful work environment. Let's break it down now in Periop Talk. So excited to have Tammy Hanks, Perioperative Practice Specialist at AORN, here with us today to discuss burnout in the perioperative profession. Tammy, in your experience and research, how is burnout impacting the perioperative nursing profession as a whole?
So a recent 2023 staffing survey showed that the AORN vacancy rate is at about 16%. And we know that the first year turnover rate outpaces all others. I think a lot of people are under the impression that it's retiring nurses and people that are leaving the profession for one reason or another that are causing these vacancy rates. But the research actually shows that the biggest opportunity for nurse leaders and for staff to grab a hold of is OR nurses in their first year.
Yeah, I've also heard the same, Tammy. Now, as it pertains to workload in the operating room, what's your perspective based on that experience and research on how that is impacting these turnover rates, this burnout that's leading to these turnover rates?
Yeah, so obviously, what is first and foremost on everyone's mind is we can't staff our operating rooms. And if we can't staff our operating rooms, we're going to have to delay or cancel cases. And nobody's happy when that happens. Your patients spend a lot of time prepping for surgery, taking off work, family members arranging rides. So the last thing we want to do is to delay or cancel surgeries that may be a very significant moment in somebody's life. So obviously, when you're talking about vacancy rate and turnover and burnout, it's easy to focus on the big numbers like surgery cancellations. But you also have to recognize that that is your same pool that's training and precepting and working with students. They play a huge role in transferring knowledge to the next generation of perioperative nurses. So we really have to take some time to focus on what burnout is doing to our first year and to our experienced nurses so that we can continue the pipeline of really strong professional OR nurses.
Yeah, Tammy, you're starting to talk about it. What are the contributing factors as you see it in perioperative nursing in particular that are leading to this stress and burnout?
OR nursing is so different from any other type of nursing. Often in a lot of facilities, there's not shifts. You don't know that you're going to show up to work at 6 a.m. and leave at 2. You may start your day at 4 a.m. and leave at 5 one day, and then the next day you're coming in at 10 and leaving at 1. So it's really hard to plan your life in a lot of OR settings. And we know that one size does not fit all when you're looking at staffing solutions. Leaders really have to get creative, listen to their staff, look at opportunities for those flexible schedules to maximize all of their workforce and to ensure that those staff that are putting in the hours are not getting burnt out and they have the resources they need to provide safe surgical care to our patients.
Tammy, let's talk about flexible scheduling. I would also include in that just any other creative solutions that you might be seeing. I know for me, one thing that comes to mind is there was an AONL compendium statement, fairly recent, and it's really gathering information from leaders in terms of what they are doing around those creative solutions, flexible scheduling being one of them. What have you seen, and or what do you think, what types of things do you think are necessary in that regard?
There's no one size fits all for staffing solutions, but it's great to share those ideas, especially if you can find a facility that is similar to yours. So I have experience in both a large academic healthcare system with multiple hospitals, multiple surgical patient populations, but I also have experience as a nursing leader in a very small surgical hospital with 3 operating rooms. So what one needs is definitely not what will work for the other. So I think sharing those ideas, presenting them in posters, abstracts, talking about solutions that you've found, I think it really works. We during our AORN conference, we met with the Retired Nurses Assembly, and they really spoke loudly about wanting the opportunity for creative staffing options for them. Maybe it's 4 or 5 retired nurses sharing an FTE. Maybe it's utilizing them for those high need projects or for preceptors or orientation. When you're a lifelong OR nurse, you don't just hang up your hat and go home. It's really hard to let go, but physically, it's a hard job. So it's hard to just walk away and give it up. They're taking all of that knowledge with them. So I think there's a lot of opportunity for creative staffing, utilizing those nurses that are close to or nearing retirement. And I think one of the biggest opportunities that is out there is really working with our schools of nursing and creating that perioperative nursing pipeline. Start getting them familiar with the operating room early on, building really strong OR preceptorships, leadership programs, and then onboarding and orientation if you have a perioperative nurse residency. Like I said, OR nursing is very, very different from other types of nursing. So even a hospital system level residency program, it doesn't always meet the needs of an OR nurse. So really putting that time and the effort, utilizing those contacts with schools of nursing, bringing in those educators with the great backgrounds in how to teach people, getting them in and helping create robust programs so that way we're supporting our new nurses. We're making sure that students come in and are getting that experience, and maybe that helps with that first year burnout and just thinking, what have I gotten myself into? This is not what I expected. So I think there's a lot of opportunities just looking at the creative staffing.
Yeah, it's interesting. You cover the 5 generations that are in the workplace, right? And how that has an impact on staffing, and then, the stress that could provide, or could lead to in the operating room. I want to go back to that first year. Tammy, you've been talking about a lot of different things that play into ensuring that first year nurse feels a part of a team. I should back up. Feels successfully onboarded. They feel confident. Ultimately, they feel competent. Talk a little bit more about that, because obviously, if that has led to the most turnover percentage-wise, that's got to be a high focus area. Is that fair?
Oh, absolutely. If you don't have robust preceptors, if you're not teaching OR nurses how to be preceptors, if you're just throwing new people in with them and expecting them to know those adult learning styles, even if you're not teaching your learners to understand what their own learning style is, everybody is very different. So me walking in and learning something new, if you just tell me what to do, I'm going to look at you like a deer in headlights. Some people that works really well. Other people, they need to be hands-on and have the opportunity to someone supervise them. So really working with your preceptors and training them on how to be good preceptors, and then making sure that your leadership structure is strong and that there's that support in there for both the preceptors and those new onboarding nurses, so that they have a safe place to go to voice concerns. Often those are going to be your best eyes in the operating room to see what opportunities you have to improve, because they really catch things that when experienced nurses are doing them every single day, they just don't even realize they're happening anymore. So I think it's just super important not only to train new nurses, but to train the people that are training them.
Tammy, do you have concern? And if so, what are your concerns about the long-term effects of the ability to attract new nurses into the operating room as they're seeing this kind of go on, whether they're in school right now or they're just coming into the profession, and they kind of see people moving in and out of these hospitals, sometimes in droves, it feels like. What do you feel like is the long-term impact of that, and what are your concerns?
I think the operating room is such a magnet for those people who are just going to be lifelong OR nurses. It sucked me in. I never thought I'd be an OR nurse, but the minute I got there, I thought, how can I stay in this environment while continuing my education. And I really think if you're looking at the generations of nurses coming up, everybody wants opportunity for growth. Nobody or very few people are walking into a job thinking, I'm just going to do this forever, especially if they walk into a job and they're feeling the stress of their coworkers, the stress of their preceptors, they're hearing the complaints that people have. You really have to have opportunities for growth.
So Tammy, given the fact that you've been in multiple leadership roles in the perioperative setting, give our listeners one or two nuggets that they should take back, whether they be a perioperative nurse or in a perioperative leadership position formally. What would you say to them to take back and to really think about and try as of now?
Yeah, for sure. I think the most important thing that any aspiring or current perioperative leader needs to do is listen to your staff. Like I said, when you don't have a one size fits all, every facility is different, pain points are different. You have to listen to your staff and get them involved in the decision making. Let them have a voice in how they seek solutions to staffing. I think you have some really brilliant minds out there that can really help come up with innovative staffing solutions that fit your facility. So if I could impart any wisdom at all, it would be listen to the people that it affects. Let them have a voice, let them be a part of it. Create opportunities for growth. I think the old school way of thinking was, we don't want to get people in here that are just going to leave. But as a lifelong learner myself and someone who continued her education throughout a perioperative career, those are great opportunities for preceptors and for taking that knowledge that you, in that time that you put into developing someone, they're still going to be with you long enough to build up your next generation of nurses.
Thank you, Tammy. That was great. I wonder if you're feeling burnt out. If you are you taking anything back to your leadership? Are they bringing proposed solutions to you? What else might be possible? Tell us in the comments below. Thank you for watching. We'll see you next time.